I think the key solutions to the nursing shortage is changing the workplace or the hospital environment or the nursing home environment for the nurse so that the nurse really has a lot of satisfaction in providing patient care. That means having more staff to help. That means having better collaboration and relationships with physicians. That means having more educational support. That means giving them the supplies and the computers that they need to do their jobs. I think that education needs to work. I think that the government needs to help us with the funding issues. I don't think patients realize how much has been cut out of health care until they actually come into the hospital and they want more service and then they can't get that service and then they're down complaining about why they can't receive it. And a lot of it has to do with all the funding cuts and the changes that were made in the last several years in health care. I believe that business is responsible for helping out too, and helping us work on improving the quality and getting more nurses in here.
Well, I think we've all got to tell our children that we're going to need a nurse one day. We're all going to end up in the doctor's offices, in a skilled nursing facility, in a hospital of some sort. Even if it's just to have a brand new baby, you're going to need a nurse by your side helping you.
Well, in our own way, I think we all have a responsibility here. I am not quick to point to any one sector. I think our educational colleagues clearly need to work within their systems to open up the nursing education pipeline. I think our nursing leadership in hospitals and across other healthcare settings need to work on improving the work environment. And I think even our unions and other constituents that are involved in influencing the nursing workforce need to look at creating a role that can be more independent and more autonomous, and perhaps recast the role of nurses that they play today in terms of being an employee.
Well, the United States government has just passed a wonderful act, the Nursery Investment Act, I think is the name of it. I might have my term not quite right there, but the Nursery Investment Act offers us, really a wonderful opportunity for the country to reinvest in nursing. And this isn't just a California problem. This is a worldwide nursing shortage that we're facing. The question is, will we fund the Nursery Investment Act? And so hospitals across the country, leaders, clinical leaders, hospital leaders have got to mobilize their advocacy efforts. I've just written a letter to our Congresswoman saying, you've got to put money into this act and really allocate the resources necessary so that we can meet the nursing shortage nationwide.
We actually have a team of people in this country that's working on that. And so hopefully we'll have some initiatives come out in the next couple of years that we can adopt to help turn that around.
Does that team of people have a timeline?
I don't think so. I don't know if they have a specific timeline. The American Hospital Association is sponsoring this effort. Yesterday would have been, too late. Yeah, yesterday is the timeline. We need it.
So if the hospital would support a high school or several high school or students who they can identify who are interested in nursing or some paramedical profession, and they give scholarships, I think that one way you can get a good turnover and you get grassroots support starting in grammar school so they can give back to the community.
We finally realized we hadn't been talking to one another. The hospital industry, we believe that we have a stake in this too, and that we need to get more of our people out into the communities, talking to businesses, talking to the chambers of commerce, working with the schools, working with anybody and everybody who will listen about what the problem is and what it is that's needed. It's amazing what a little communication can do.
So I think that the media has a major role, major opportunity to play in attracting more people into nursing, which is where it all starts anyway.
I think that the media needs to portray nurses in a much more positive light.
The most important message that the media needs to take to heart today is really to work on highlighting the contributions of nurses in patient care. whether that occurs in the traditional healthcare environment of hospitals or whether it is accomplished in communities and other types of healthcare delivery systems. The traditional role of nurses needs to be recast, and I think the media can actually very much help us do that.